In terms of the erectile dysfunction, that's something that I think is probably on the mind of many men because they want to be able to continue to be active in that way. Is there any data that show us how frequent it is that someone loses their erectile dysfunction, and if there's data about how many men actually recover it after, in the months or years after the surgery?
Correct. So nothing is ever simple, unfortunately, in medicine. And so it really depends on how men's erections are coming into the surgery. And as we know, as men get older, there is a higher chance or risk that they might already have erectile dysfunction, maybe to some extent already. So if men come into the surgery with very good erections, and we can do what we call a nerve-sparing surgery, where we try to preserve the nerves that help with the erections and just take out the prostate, then I think it's true that we can get the erections back in up to 80% of cases. So the results can be excellent even for the erections, but at the same time we have to be realistic, and if the cancer is more aggressive and we have to sacrifice some of the nerves that help with the erections, or if the man doesn't come in with perfect erections, then we have to be more realistic that there is a higher chance that we won't get the erections back with time.
And so it sounds like there's a trade-off really between being aggressive enough to for sure get that cancer versus doing a nerve-sparing surgery, which might make it less likelihood that someone would lose their erectile function, but does that affect the potential surgical outcome for the cancer also?
It does, but that's our job as surgeons, to tailor the surgery specifically for that patient. So if the patient has poor erections and a somewhat aggressive cancer, then we don't want to perform the nerve-sparing surgery, because then it leaves him more likely to have cancer return, or for us not to cure the cancer. Whereas somebody with excellent erections who has a less aggressive prostate cancer, we can be a little bit more aggressive about saving the nerves and give us a much better chance of maintaining those erections with time.
Yeah, so that's where your experience and training comes in to make those distinctions.
Yes, all urologists.
Sure.